their rights and they're afraid to assert them. So there's a lot of beneficiary education that's needed. And at the end of the day, there's still the problem of providers refusing to see duals because they lose 20% every time a dual walks in the door. There was a 2-year bump up in primary care Medicaid rates, bumping them up to the Medicare levels. It was a 2-year authorization, but unfortunately it expired in December. There was 100% federal match during that bump up period, so it didn't cost the states anything. And the idea had been that this would increase access, and then the states would independently pick up the higher rates and keep those higher rates going. But unfortunately, that just happened in a couple of places, and most states just went back to their usual low rates. So certainly that's an area for advocacy at the state level. And again, that's a place where there's really a lot of common ground between providers and advocates. And finally, we put together a list of the resources for the federal law that we discussed today. And as noted before, this is just federal law, and you should also be looking at relevant state law. And all of this will be on the link to the slides that is on our website and that you also should have gotten by now. And also, I just finally wanted to make a pitch that for the Californians out there, I'm going to be participating in another webinar next week that's hosted by California health advocates on balance billing protections that apply specifically in California, and also on concierge medicine and other non-Medicare charges that beneficiaries sometimes face. And we can send the registration